Hello guys, how are you doing today? Welcome to my YouTube channel. It's still your girl Monica Austin in the building. Please don't forget to subscribe to this channel and hit the notification bell in case if we upload a new video you can go ahead and check it out. So today we are going to discuss an important thing to our health. I know you know what you're about to watch. So signs and symptoms of vitamin B12 deficiency plays an essential role in the production of your red blood cells and DNA, as well as the proper functioning of your nervous system. Vitamin B12 is naturally found in animal food, including meat, fish, poultry, eggs, and dairy. However, it can also be found in products fortified with B12, such as some varieties of bread and plant-based milk. Unfortunately, B12 deficiency is common, especially in the elderly. You are at high risk of deficiency if you don't get enough from your diet or aren't able to absorb enough from the food you eat. People at risk of a B12 deficiency include the elderly, those who have had surgery that remove the part of the bowel that absorb B12, people on the drug metformin for diabetes, people following a strict vegan diet, those taking long-term antacid drugs for heartburn. Unfortunately, symptoms of vitamin B12 deficiency can take years to show up, and diagnosing it can be complex. Vitamin B12 deficiency can sometimes be mistaken for a folate deficiency. Low levels of vitamin B12 cause your folate level to drop. However, if you have a B12 deficiency, correcting low folate level may simply mask deficiency and fail to fix the underlying problem. There are nine signs and symptoms of true vitamin B12 deficiency you must know. Number 1, pale or jaundiced skin. People with B12 deficiency often look pale or have a slight yellow tint to their skin and white of the eyes, a condition known as jaundice. This happens when a lack of B12 causes problems with your body's red blood cell production. Vitamin B12 plays an essential role in the production of the DNA needed to make a red blood cells. Without it, the instructions for building the cells are incomplete and cells are unable to divide. This causes a type of anemia, megaloblastic anemia, in which the red blood cells produced in your bone marrow are large and fragile. These red blood cells are too large to pass out of your bone marrow and into your circulation. Therefore, you don't have as many red blood cells circulating around your body, and your skin can appear pale in color. The fragility of these cells also means that many of them breaks down, causing an excess of bilirubin. Bilirubin is a slightly red or brown color substance which is produced by the liver to break down old blood cells. Large amounts of bilirubin are what give your skin and eyes a yellow tint. If you have a B12 deficiency, your skin may appear pale or jaundiced. Number 2, weakness and fatigue are common symptoms of vitamin B12 deficiency. These occur because your body doesn't have enough vitamin B12 to make red blood cells, which transport oxygen throughout your body. As a result, you are unable to efficiently transport oxygen to your body cells, making you feel tired and weak. In the elderly, this type of anemia is often called autoimmune condition known as pernicious anemia. People with pernicious anemia doesn't produce enough of an important protein called intrinsic factor. Intrinsic factor is essential for preventing a B12 deficiency that binds with vitamin B12 in your gut so that you are able to absorb it. When you are deficiency in B12, your body isn't able to produce enough red blood cells to effectively transport oxygen throughout your body. This can make you feel tired and weak. Number 3, sensations of pains and needles. One of the most serious side effects of long-term B12 deficiency is nerve damage. This can cause over time, as vitamin B12 is an important contributor to the metabolic pathway that produces the fatty substances myelin. Myelin surrounds your nerves as a form of protection and insulation. Without B12, myelin is produced differently and your nervous system isn't able to function properly. One common sign of this happening is paresthesia, or the sensation of pins and needles, which is similar to pricking sensation in your hands and feet. That said, sensation of pins and needles are common symptoms that can have many causes. The neurological system also associated with B12 deficiency usually occur alongside B12 plays an important role in the production of myelin. About 28% of people sensation of pins and needles are common symptoms that can have many causes. So these symptoms also is not usually a sign of B12 deficiency. B12 plays an important role in the production of myelin, which isolates the nerves and is critical to your nervous system function. A common sign of potential nerve damage in B12 deficiency is a sensation of pins and needles. Number 4. Changes to mobility. If untreated, the damage to your nervous system caused by a B12 deficiency could cause changes to the way you walk and move. It may even affect your balance and coordination, making you more prone to falling. These symptoms is often seen in undiagnosed B12 deficiency in the elderly, as people over the age of 60 are more prone to a B12 deficiency. However, preventing or treating deficiencies in this group may improve mobility. Also, these symptoms may be prevented in young people who have a severe untreated deficiency. The damage caused by long-term untreated B12 deficiency can affect your balance and cause changes to the way you walk and glossitis and mouth ulcer. Glossitis is a term used to describe an inflamed tongue. If you have glossitis, your tongue changes color and shape, making it painful, red, and swollen. The inflammation can also make your tongue look smooth, as the tiny bumps on your tongue that contain your taste buds stretch out and disappear. As well as being painful, glossitis can change the way you eat and speak. Studies have shown that a swollen and inflamed tongue that has long stretched lesions on it could be an early sign of vitamin B12 deficiency. Additionally, some people with a B12 deficiency may experience other oral symptoms such as mouth ulcer, feelings of pains and needles in the tongue, or a burning and itching sensation in the mouth. An early sign of B12 deficiency may be a red and swollen tongue. This condition is known as glossitis. Number 6. Breathlessness and dizziness. If you become anemic due to a B12 deficiency, you may feel short of breath and a bit dizzy, especially when you expect yourself. Usually breathless, you should speak. Anemia caused by vitamin B12 deficiency can cause some people to feel breathless and dizzy. This occurs when the body is unable to transport enough energy to all its cells. Number 7. Disturbed vision. One symptom of vitamin B12 deficiency is blurred or disturbed vision. This can occur when an untreated B12 deficiency results in nervous system damage to the optic nerve that leads to your eyes. The damage can disrupt the nervous signal that travel from your eye to your brain, impairing your vision. This condition is known as optic neuropathy. Although alarming, it's often reversible by supplementing with vitamin B12. In rare cases, the nervous system damage caused by a B12 deficiency can affect the optic nerve. This can result in blur or disturbed vision. Number 8. Mood changes. People with vitamin B12 deficiency often report changes in mood. In fact, low level of B12 have been linked to mood and brain disorder like depression, dementia. The Homo-Sanctina hypothesis of depression has been suggested as a potential explanation for this link. It's important to note that changes to mood and condition like dementia and depression can have a variety of causes. Thus, the effect of supplementing in this condition remains unclear. If you have a deficiency, taking a supplement may help improve your mood. However, it's not a substitute for other proved medical therapies in the treatment of depression or dementia. Some people with B12 may show signs of depression mode or condition characterized by a decline in brain function such as dementia. Number 9. High temperature. A very rare but occasional symptom of B12 deficiency is a high temperature. It's not clear why this occurs, but some doctors have reported causes of fever that has normalized after treatment with low levels of vitamin B12. However, it's important to remember that high temperatures are more commonly caused by illness, not as a B12 deficiency. On very rare occasions, one symptom of B12 deficiency may be a high temperature. The bottom line, vitamin B12 deficiency is common and can prevent itself in various ways, making it difficult to identify. So if you are at risk and have any of the symptoms above, speak to your doctor. For more people, a B12 deficiency should be easy to prevent simply by ensuring you are getting enough B12 in your diet. So if you're among this category, please don't let yourself down. Report to your doctor, or you go to the nearest hospital to report to yourself, and you explain to them the signs and symptoms that you are having in your body, so that they will as well prescribe the drug that you will take and the food that contains vitamins B12, so that you'll be able to eat up and balance yourself. Thank you so much. Thank you for listening, and thank you for watching. Please don't forget to hit the rest notification bell in case if we upload a new video, you can go and check it out. Don't forget to like, share and comment. Thank you so much. Bye. See you next time. I love you all.